This is Washington Unplugged. President Obama today is selling health care reform once again in Portsmouth, New Hampshire, where he's being greeted predictably by protesters like those who have been speaking out at town halls all across the country. You may know the rhetoric from both the left and the right, from activists to politicians, has been misleading at times, to put it mildly. So we've assembled a little truth panel today to examine some of the most frequent claims. I'm joined now by Brooks Jackson, the director of factcheck.org from the Annenberg Public Policy Center of the University of Pennsylvania, and also Alicia Mundy of the Wall Street Journal. Thanks to both of you for coming in. So we're going to take these one at a time. We're going to move fairly quickly, but these are some of the ones we hear from time to time. Let's put up the very first one. Some Republicans claim the House bill either mandates or encourages euthanasia. Brooks, you get first crack.
No mandate. What it does is say that end-of-life counseling, issues like advance directives, that sort of thing, will be covered by Medicare. But look, Medicare covers hip replacements. It doesn't mean you have to get a hip replacement.
Now, do you have to do the end-of-life counseling?
No, you don't. It's optional, and it's a voluntary thing, and it's a very nice offer. And part of it actually came out of a member of the Senate, Senator Mark Warner, who, when he was governor of Virginia, had proposed trying to get into end-of-life counseling to help families have discussions so that older people would ultimately have control over their lives. It's interesting you mentioned Portsmouth, New Hampshire today. Republican Judd Gregg of New Hampshire, the senator, in fact is very much in favor of having end-of-life counseling. He's pointed out numerous occasions that when you look at the facts and figures, end-of-life costs are $50,000 and upwards per year per person, and yet frequently don't provide any more end-of-life quality to the individual patients involved.
This has really riled up seniors, though, and it's frightened a number of them. But that's not really President Obama's constituency. So these are people that might be predisposed to any kind of change.
Might be, I don't know.
Possibility. Let's take a look at number two, and this one kind of relates to number one. We've heard from time to time, and this often comes from the Republican side, that health care will be rationed. In other words, you won't get exactly what you need. Brooks?
Well, it depends on what you call rationing. Look, you got rationing now. If you want a heart transplant, you go on a list because there are a limited number of hearts available. But if what people mean by rationing is that there's going to be some government official somewhere passing on every claim that you put in and deciding whether you, a patient, can get a particular treatment or not. No, there's not going to be anything like that in any of the bills that are now before Congress.
But if we're going to cut out waste, and one of the things everybody seems to agree on, we have to cut out the waste, doesn't that kind of translate into choosing and rationing?
It translates into what your doctor chooses and discussing how that's going to be covered. What's going on right now is that the government under President Obama proposed something called comparative effectiveness research, which basically would compare treatments. So for instance, is a cheap diuretic, a cheap water pill, just as effective in controlling your blood pressure as one of those very expensive hypertension drugs? The pharmaceutical industry in particular has launched themselves practically physically against the idea that comparative effectiveness research, comparing treatments, would translate into cost effectiveness research, because they want to promote the most expensive treatments, the best treatments, but the most expensive treatments. And that's where you're starting to hear the word rationing, because it's a threat to specialty hospitals and the pharmaceutical industries if you start saying, let's compare what's really effective and see what works, and then while we're at it, let's look at the cost.
All right, the Democrats primarily, and the president repeatedly has made this claim, that health care reform, no matter what it eventually is at the end of the pipeline, will be deficit neutral. In other words, we're not going to add any cost or any burden to the deficit. Alicia, is that even possible?
I don't know that that's possible right now. The way it's scored by the Congressional Budget Office, it looks as though they're missing billions of dollars that they have to account for. One of the little oddities in this is that the Blue Dog Democrats and some of the fiscal conservative Democrats are supporting a number of measures in this that different industries want, that in fact CBO has scored at saving tens of billions of dollars, but in fact they're not being included. So some of those items, for instance, such as more Medicare Part D rebates worth $63 billion, that's not even in sight here.
There's stuff that's off the books. I think they've promised doctors that they wouldn't see cuts down the line, and that's billions, I think, isn't it?
That's
Brooks?
right. Well, first of all, what they're promising doctors is that they won't institute these very deep and severe cuts in Medicare payments to doctors. So that's an added cost. That's not a saving. That's something they have to pay for before they start paying for any health care overhaul.
So if it's to be deficit neutral, they've got to account for that plus the stuff we know we've
exactly, and they're not there yet. It remains to be seen, I think, is the best answer, whether what combination of reductions in future Medicare spending and future tax increases are going to pay for this thing. But right now, it's not paid for as things stand. It's very much a moving target and a work in progress.
Now, some of the issues are particularly contentious and volatile, and here's one we hear from time to time, and that is that health care legislation that's now working again through the pipeline mandates that taxpayer dollars be used to pay for abortions. I've read the language. I don't profess to know what's in all the pages of both those bills. I haven't seen that.
Well, you want to take that?
No, you go.
Well, look, there's no mandate in the bill. The bill, we're talking about the House bill now, which is the one that's most detailed and fully available on the internet, is actually neutral as to whether a federal plan, a new government or public plan would cover abortion services, or whether the government would require private plans to cover it to qualify as a basic plan. It's just neutral, doesn't say anything. But there's a legitimate concern here, I think, by those on the anti-abortion side, that the administration might administratively, if such a bill is passed, either require that the federal plan cover abortion services, or that private plans be regulated in such a way that they would.
So if it's ambiguous enough, if the language is loose enough,
right,
it could be interpreted in by executive order, I suppose.
That's
the fear.
That's the concern, and what the anti-abortion side is seeking very vigorously is specific language, something like the Hyde Amendment that prevents taxpayer dollars from being used for abortions and other health programs. Something inserted that very specifically would prevent that from happening. It remains to be seen which way Congress is going to go on that.
Okay, let's talk again about a senior issue in Medicare. It's a little confusing to people as to what's going to happen to Medicare, and maybe we don't know yet. Cuts to Medicare. Alicia, is that Democrats say, well, we're not going to cut any benefits, but at the same time they say we have to eliminate waste. Republicans are warning of big cuts. What's real? They're
going to try and cut Medicare expenses without trying to cut services, and somewhere in there you have to figure out how does that translate. And I don't think they've been specific yet, and perhaps it's just something they don't want to be specific on yet, about where those cuts come in. Is it doctors? Is it hospital stays? It has to come from somewhere. So ultimately they're trying to say, at the one hand, the receiver of the benefits, you won't lose any services, but somewhere along the line, somebody's not going to be permitted to continue giving those Medicaid services because they're not going to cover them.
Can they manage it that well? I mean, really, can they wring that kind of waste out of whatever is there and still maintain really quality service?
Well, that's the big question, and it's amusing to me, as one who's covered politics in this town for a long time, to see how the shoe has shifted feet here. It was only last October when John McCain was proposing that he could finance his health care plan in part by what they called savings in Medicare. This was immediately spun in two ads, which at factcheck.org we criticized as false, by the Obama campaign, because the Obama campaign was saying he's going to cut benefits, he's going to reduce benefits. Well, now Obama and the Democrats are proposing to get even bigger savings out of Medicare. They call them savings when they do it. They call it cuts when the other side does it.
It's
so
Washington.
It remains to be seen if you can somehow squeeze down the future growth in Medicare spending and maintain the current level of benefits. At some point, it may be that somebody is going to have to say no to some people who want very expensive treatments. And we just don't know yet.
But this kind of uncertainty makes it easier for both sides to demagogue the issue.
Well, and in particular, what's funny is that over the years, the Democrats have been able to draw on seniors and AARP to back them up. So, for instance, some years ago when people were suggesting, particularly Republicans, were suggesting privatizing Social Security, I mean, you had 89-year-olds marching in the street. This is a very good issue for Republicans in particular to be able to use to say you're going to start losing your Medicare benefits, because suddenly the Democrats have to worry about how they keep those seniors and the senior organizations on board.
Okay, and the sixth major point we want to get to today, private plans and private insurance. Once reform is enacted, will people be able to keep their private plans and private insurance? And frankly, I don't understand this one. I don't understand a lot of it. But the Democrats have said, well, you can keep your private plans. Republicans have warned you might not keep your private. What's going on here?
I had a doctor who's actually at a hospital here in Washington, D.C. I'm having coffee with last week, and he leans over and says to me, so under this plan, can I keep my insurance that I have through the hospital here? And I thought, okay, we're in real trouble if the message isn't out there, if the White House can't clarify it this far, this is a problem. So yes, technically, you will keep your private plan. You don't have to worry about that. Nobody's taking it away from you. But if you're an employer, and all these new plans come into being, you may be adjusting how you cover your employees. So in theory, that might change, although in practice, I can keep my private plan.
And I'd add to that, there will be new regulations of health insurance. That's when we say, or the proponents say, that no longer will insurance companies be able to deny coverage for pre-existing conditions. Well, if you have a plan that doesn't cover pre-existing conditions, that plan is either going to have to change or be pulled off the market. So, yes, you can keep your plan. However, your plan may have to change over time to meet the new federal standards. Is that a good thing or a bad thing? May depend on just what is being added or subtracted.
And we
from
really
your
haven't even talked about public option. I mean, what's your best guess there? You both look at this much more carefully than I do. Are we going to have a public option in this plan? What's your thinking, Alicia?
I have no idea, and I don't think the White House does either at this point.
Well, that's a big fight. Well, I think it's worth noting that even if whether or not you have a, by the way, we call it a federal plan because the Democrats, the proponents, like to call it a public option. Sounds good. The other side likes to call it a government-run option. Sounds bad. So we try to.
We should explain to people. We're talking about a government plan that basically administers health insurance.
Something like Medicare
that would compete with private
but
plans.
For younger people who can't afford their own coverage. Yes, it remains to be seen. It's going to be a big fight. But I think people should not take their eye off the fact that there are many other parts of what's being proposed that would be beneficial to do and would bring about big changes in health coverage, make it less expensive and more widely available, whether or not you have a federal option as part of it.
And that's why getting bogged down in public versus private plan, and will there be a public one, is an easy way to deflect it away from some of the things, for instance, covering the seniors in the donut hole and their drug expenses. It's easy to deflect attention away from something that actually will pay off if you get bogged down into this, because then you get to raise words like socialism, and that works.
Yeah, we've heard a lot of words raised. Well, it's a confusing issue. Brooks, thanks for coming in. Alicia, thanks for joining us.
You.
And I hope we've maybe clarified at least a couple of points. And thanks to you for watching Washington Unplugged today. Join us here every weekday at 12:30 at cbsnews.com. I'm Bob Orr. Have a great day.